President Trump has signed an executive order forcing low-income individuals and families to work to receive public benefits. This is a long-awaited order that's been in the works for a while, and it was finally signed on April 10th. It's called the Reducing Poverty in America Order, which is a little ironic since most of the research coming out of different states and agencies is suggesting it's going to do the exact opposite. We'll point you towards some of those resources in just a moment. But let's look at the intent of this executive order. Simply put, it says that they intend to force low-income recipients of public benefits programs to work or lose those benefits. This would extend to programs of food security, housing assistance, and Medicaid assistance for the first time. You know, there used to be an understanding that when people were receiving cash benefits, there might be some heightened requirements to get into that eligibility for those programs. This is different. This is food, housing, and medical assistance for the first time. Very different from the welfare programs that we know of the past with cash assistance. And yet, this is where we are today, where there's a very politically charged agenda to make sure that we can put these work requirements across the more vulnerable populations, essentially to lower the participation in those programs. Some people are actually calling this duplicative because this administration has made very clear that it's going to approve work requirements coming out of state requests for such things as Medicaid Section 1115 demonstration waivers. HHS, Department of Health and Human Services, through Center for Medicare and Medicaid Services, has already been approving some of those state requests to add work requirements in Medicaid. This was just something coming out of the president's office to make it very clear where they stand on work requirements. So what does it actually do? Are work requirements mandatory right now? No. The way the executive order is written is it gives the departments, such as Health and Human Services, 90 days to create a plan. That plan has to show three things. It has to show that they will be imposing work requirements on able-bodied recipients. You've seen that able-bodied term being used more and more recently to refer to adults that don't have a finding of disability. The department also has to create a plan that blocks ineligible immigrants from getting aid. So you can see another politically charged discussion that's entering into this executive order. And finally, it has to draft recommended regulatory and policy changes. And this is where the devil will be in the details, what those recommended policy and regulatory changes will look like. You can also bet this might be the hook for some litigation coming out of recipients and states down the line. So the agencies have 90 days to get a plan together to describe how they want to do this. Now, like we said, many researchers that have been studying food assistance and housing assistance and Medicaid assistance for years have been very vocal and adamantly against this type of requirement. They say, first and foremost, there is no data to support the position that low-income individuals avoid work. They don't agree with the premise of this at all. Second, they do say those who aren't working are facing obstacles to work, as you can imagine. Health conditions that maybe don't rise to the level of a disability determination, but still impede someone from holding 20 hours a week, 29 hours a week that we're starting to see out of some state requirements. And again, complicated family situations that are impeding a full-time or part-time work schedule. Now, a Michigan study has said that actually 75% of the people participating in Michigan Medicaid are already working or are physically unable to. And an additional 12% are children or seniors that are exempt from the requirement. So this is really trying to impose this political statement more than a work requirement statement. Like Wisconsin, the president is calling this his welfare reform package, and we've talked about this in other video case tips, how welfare usually was used to refer to cash assistance, but it's more politically charged than saying food assistance or Medicaid assistance, and that's why it's being co-opted and used in this capacity. You can read that executive order for yourself and decide for yourself what your thoughts are, and share them with us. We share the executive order language in this link. Let us know what you're thinking. We can talk about this more. We've got 90 days to see what the agencies are going to put together, and then we'll revisit this and take a look at those plans as they become more clear. Thanks for joining us.